Hello and welcome to the Functionally Enlightened podcast with Dr. Sharon Sarita. We interview well-respected medical and functional practitioners, as well as patients who have overcome disabling chronic conditions, such as dysautonomia, and reclaimed their health. These enlightened guests provide helpful tips on managing chronic pain and illnesses, using a combination of traditional and whole body healing modalities. If you're interested in natural healing and quality of life improvement, you're in the right place. Thank you for listening to today's episode.
Welcome, everyone, to the Functionally Enlightened podcast. Today on the show, we have Dr. Anju Mathur, who is the founder and medical director of Angel Longevity Medical Center. Here, she specializes in treating all sorts of chronic illnesses. She also works with menopause and hormone imbalances and gut health, which are all things we do look at with chronic illness. And her journey into integrative medicine really began after facing her own health challenges, similar to many of our guests on the show. And this journey led her to explore alternative approaches when the conventional options fell short. Today, she's passionate about treating the whole person, not just the symptoms, and she tailors her care to each patient's unique biochemistry and lifestyle. Dr. Mathur primarily works with clients who are navigating chronic illness, many of whom struggle with the symptoms we're all so familiar with, so fatigue, that hormone disruption, autoimmunity, and complex gut issues. She's known for her deep commitment to education and to guiding her patients through long-term healing with realistic reminders that healing really does take time and patience. So we thank you for being on the show today, Dr. Mathur.
Well, thank you very much for having me on your show.
Absolutely. So can you tell us a little more about what drew you to diving into more than just a conventional health space?
Yeah, well, I started out as a conventional medical doctor. I was a family practitioner, just seeing families and, helping them with their medical issues. But then I realized that what I was doing was basically managing the symptoms. We were not really healing from inside or resolving the issues, but they were more like management. And this is really what the medical industry is about, is managing your symptoms. And then it just happened that I myself got into a situation where I was like perplexed, because I didn't really know why I was feeling the way I was feeling, which was basically no sleep and no energy. Literally, those were the two problems. And I was like, this is not normal, because I was pretty young. I was like 40 something, right? And I was very surprised. And I did all my testing, the regular testing that a primary care physician would do. And I did all of that, and there was nothing wrong with any of those tests. Mm-hmm. So, and I did seek help with other practitioners, other physicians, and the answer that I got was, there was nothing wrong with you. And so that was kind of interesting, because I realized that, wow, if there was nothing wrong, then why is it that I have trouble sleeping? And why is it that I don't have energy? And what is going on? So I decided to take matters in my own hands, so to speak, which I think most patients who are suffering for long term, they want to understand like what's happening. So I wanted to understand. So I dug deep into it, and I looked at all different factors, like what's happening. I did little by little, was step-by-step procedure. The first thing I did was nutrition, to find out there must be a right diet that is unique to each of us, and it couldn't be the same diet for everyone. So I started researching to that, and lo and behold, I got invited to one of those anti-aging conferences in Beverly Hills, California. And as I entered the room and I saw all these physicians who were super excited about what they were doing, and they looked cheerful, they looked bright, they looked like they were living a life, which was very much in contrast to all other conferences that I was going to. As a physician, you have to attend a certain number of conferences each year. So I was going to all those conferences, and I remember even myself was like, okay, let's sign it and just let's get out of here, right? That was the attitude of most of us. But in this particular conference, I saw that the doctors were very much into and interested in what they were doing. So that was kind of a contrast and kind of an eye-opener for me. And I said, okay, great. I'm going to see what these guys are doing, and I want to learn it. And that happened to be a bioidentical hormone replacement therapy seminar. And so I started from there and I learned more. I say, okay, this is, so little by little, I handled myself. Within about a year and a half, I was back to normal. So that was my own experience. And at that one time, one day, I could tell you the story, which was very interesting. I did a liver cleanse. Now, mind you, as a physician, you are never told or enlightened or taught about anything to do with detoxing. Even though we all know there's a detoxification pathways in the liver, phase 1 and phase 2, but we are never taught that you could do that externally. So when I did that liver detox and I saw the major flip in my health, I literally felt so much better. And I couldn't believe the gallstones coming out, right, in the stool. And that's the moment that flipped in my thinkingness. And I thought, you know what, I can't really pretend that this didn't happen, because it did happen.
Yeah, well, take us back to that liver cleansing. Tell us a little bit more about what was involved, how long it took, and what kind of, did you experience any side effects while doing it?
Yeah, absolutely. It's not side effects. See, the thing is, there is a definition of side effects. So the side effects means that you take a drug or medication in the normal recommended dose, and in spite of taking in the normal dose, you feel the adverse effects, which are called side effects. But when you're doing a cleansing, you are basically getting the body to release all the toxins. So you feel some of those effects. So when I did the liver cleanse, I think I did about 7 days of liver cleanse, and first 5 days it was preparation. I think with for phosphoric acid and malic acid, those are the two things I was taking. Malic acid is something that's found in apples. So it's almost eating like apples, but you're not eating apples. It's a concentrated form of malic acid. So I was taking that, and then I was taking phosphoric acid to dissolve anything that's related to bile in the liver and gallbladder. And then on the 5th day, I did the actual cleanse, where you drink the olive oil, and you can do the coffee enema with Epsom salt. You can drink some Epsom salt and all that. So I did all the magnesium, and I did the oil. So that, or when you drink the oil at night, it gets the gallbladder to squeeze out whatever is in the gallbladder. And that's what you see in the morning in your stools, that greenish stuff that could be floating on top in the water. So that was like a completely like amazing thing that I had never seen in my life before. And at that point I realized, okay, I can't really deny the existence of detoxification that you could potentially do for yourself. And then I remember the next day, on the 7th day, the 6th day I did the cleanse, and then 7th day, I couldn't even, I mean, I was like sleepy the whole day. I couldn't, I was so exhausted. I was so exhausted. It's like you're coming out of a flu. You feel like you have a flu-like symptoms, but you are kind of getting out of it. So it's a good feeling, even though you are kind of sleepy and you're kind of knocked out, but you feel like, okay, something good is happening. So the entire day I was in my chair, and during the day, and I would just wake up and I would go into the kitchen, make some food, eat some food, go back to sleep. And that was very interesting to me, because like I said, as a physician, none of that actually should be happening. I mean, this is like, it's not real. It's very unreal. Mm-hmm. But the following day, when I woke up, I felt so much better. I was like floating. It was just fantastic. I was feeling fantastic. The energy was through the roof and was very good. I slept very well. So the following day, when I came to the office with my patients, and I realized I can't really keep this as a secret from my patients, because that's not okay. And so I asked the first patient, I told the patient, look, this is what I did, and I feel awesome. And they're like, wow, tell us about it. I was surprised, because I thought they would say, what? This is like a, foo-foo. They would foo-foo me. And they would say, oh, this is, but the patients were very interested. So I said, okay, if they're interested, then I'm going to tell them. So that's how I changed my practice from mainstream into alternative.
So did you develop a sort of protocol that you use, or you advise your clients to do, or is it more of a bio-individual thing with each client?
It is very individual. Not everybody does the same thing. You definitely have to see what it is that you need. So we have a personalized approach. Liver cleanse is one thing, but there is many, many things that you will need to do in order for you to feel well, because the body is a multi-system organism. So we don't just have liver, we have lots of other organs. So there's many organs and many systems in the body, and they all have to bring themselves into harmony with each other, which is a word that we use in medicine is called homeostasis. So that you need to bring the whole body into homeostasis, so then you can feel like yourself again.
Yeah, I love that you're taking that approach. You're not specializing in one organ system. You're looking at the body as a whole. And that's what we often like to see, like looking at hormone, immune, we're looking at digestion, detoxification, energy production, and even the nervous system. So all those components come together, I know, to kind of formulate your protocol or a plan for your specific patients. Now, going into that a little bit, so what type of clientele comes to see you? What kind of chronic conditions are you seeing more often?
Oh, well, we see practically at this point in my career, I feel I could practically help any individual with any chronic disease. You could have any chronic disease. When I started working in so let's back up a little bit. So I started with bioidentical hormones, right? So I was doing that. I was doing immune treatments. I was doing all of those. And little by little, I was getting really good at that. So I was like, okay, this is fantastic, but I need more challenges. So I started taking more and more complex patients. And at this stage of my career, I get very complicated patients who are basically, you can imagine the complexity starts because there's many systems that need to be adjusted. It's not one thing that's wrong with them. It's mostly a lot of it. So then I have to kind of navigate through that and get them out of it. I call it a maze. It's a maze. So I have to kind of, walk them through and out of the maze so they can be stable.
That makes sense in terms of the terminology you use. It's definitely a maze. It's a puzzle. We have to solve it. And I'm going through thinking of a client again, or a patient of yours coming into your office. Where do you start them?
So I take a very, very detailed medical history with the timeline. So we don't ignore anything that's happened to you throughout your life. So we start from the beginning and what has happened. And then we go into like family history, lots of different information that we want to have. And then your symptoms, like what are your symptoms, what's happening. Based on all of that, then I recommend certain types of lab testing that's appropriate for you, because not every lab needs to be done. There is like a gazillion labs that could be done, and you could be completely lost because there's so much data that you can't even use. And where to start, right? That's like your question. Where do you start?
Right.
So I make it really simple and very simple. Let's do the basics. What happens that I see is happening is like people they don't understand the basics. So there is a basics. For example, nutrition is a foundation of health, because that's the fuel that fuels our bodies. And if you're not putting the right fuel in the body and the right fuel mix, you can't expect anything else to be nourished. Right? So we start, I don't start. Here's how I do it. I do it because it's a complex. People don't have time to wait to get better. So I make it like rapid and get to the bottom of it fast so they can start feeling well pretty quickly, because I don't like to see people in pain.
Right. So let's start there then with the nutrition component. We like to do food sensitivity testing for some. We also like to establish what their metabolic typing is, like what macronutrient ratio best fits them. So how do you approach the dietary component for the initial steps?
That you said it. You said it. This is exactly what we do. We do food allergies, which is a blood test. It's not a scratch test.
Okay.
It's the blood test. So we check for different antibodies and different foods that you might be eating, depending on what you're eating. And some people are Asian, so we have an Asian food panel. if you are eating whatever else you're doing, Thai food, whatever food, Indian foods, we have the panels that you could use to determine what you could be allergic to. But in general, when person has an autoimmune disease, food has a role to play in it. Definitely has a role to play in it. So what I do is I take people off of gluten and dairy right off the bat.
Mm-hmm.
I don't even think twice about it. It's more like, okay, let's just get you off of gluten, get you off of dairy. Now realize it's not there's something wrong with gluten or dairy by itself, but the way it is processed in this country makes it pretty not good for human consumption. Let's put it this way.
Right.
And so people develop multiple things because of that one thing that starts a chain reaction in the body. So I just take people off of gluten and dairy. The first thing you have to do, then just do that. That by itself will make some change. It may not resolve all of it because it's not going to, but it will improve the condition. So finding the metabolic typing, like what exactly is the correct macronutrient ratio for you, and then fine tuning it to yourself will be the next step.
Yeah. Do you have to dive deeply, or do you find that you have to dive deeply into like adjusting those macros even on a daily basis? Like some people do better with a higher fat percentage in the morning, or do you feel like it's enough to say this is your general macronutrient per the day for each of your meals?
Right. I mean, if you really realize that we have a very busy lives, all of us. We don't really have time to go weigh everything, find out how much fat. It's just very hard. So metabolic typing is more like a practical way to live your life.
Mm-hmm.
And so you're not like encumbered with so many tasks that you have to do like specific things, breakfast, lunch, and dinner. I mean, some patients who are very, very sick, so it depends on what level of illness you have.
Mm-hmm.
Some people who are very, very sick, yeah, we might have to do that. Absolutely. You have to see what's going on. And if the person is okay, it's not that big a problem, then they have to just visualize and just see what it is that is the correct ratio for them by just eyeballing your plate. If you eyeball your plate, you find out how much fat, how much protein, and how much carbs is in your plate. And is it the right kind of carbs, is it the right kind of protein, the right kind of fat, then the chances for you to be successful is much higher.
Yeah. And when they find the right type for them, they also can work on that blood sugar regulation piece without having to put too much emphasis on it. It kind of works itself out as long as they're in tune with how they're feeling with the meals, like within 1 to 2 hours, like really think about how you're feeling in terms of energy and any other digestive upsets or even neurologic symptoms. Do you see that people do exhibit these kinds of neurologic symptoms with brain fog and fatigue?
Absolutely. I mean, people get irritated. It's a mental symptom that people can get depression and anxiety because of eating gluten. The studies have been done to show that very clearly. Studies have been done. In fact, I get reminded of one study where it was done in London, I think London Mental Hospital, and they took off the gluten for all the inmates for 1 month. And then half of the inmates became normal. And then they repeated the test 3 times because it was so startling finding. They repeated the test 3 times. They put all the gluten back and the symptoms came back for most of the patient. And then they took it away again. They did it 3 times. And it was absolutely confirmatory that the food has something to do with, especially gluten. So this is why I get people to come off of gluten. So whatever contribution to their physical condition the gluten is making, let's get rid of one thing.
Mm-hmm. Yes.
And then you go to the next and the next. But there is many reasons of why somebody develops a chronic disease or even an autoimmune disease.
Mm-hmm.
So we look at all those factors. But nutrition, like you said, it's the key, it's the foundation.
Absolutely. And so we tackle that nutrition piece. What's next for your clients or your patients?
Yeah. So the way I operate is that I do most of this. So whatever is a big problems, I start working on all of them at the same time. So when I start working with them on all of them at the same time, it shortens and the time period that's going to take for them to come out of it. And there is a synergistic effect. I feel there is a synergistic effect. That means they get more out of it than by doing one thing at a time. If they do one thing at a time, it'll take them 10 years to do what we are doing in 4 months to 6 months. So that's how I work with patients. I'm addressing their nutrition at the same time I'm addressing their immune system, or I'm addressing their hormonal system, or I'm addressing their gut. Whatever I'm doing, gut testing takes time. It's about 4 to 6 weeks of time. So I don't want them to wait and not make any progress. So I get them to do all testing quickly, and then we start working on what we find as we find it.
So what are the types of testings that you prefer for gut testing and the hormone testing?
Yeah, so the hormone testing could be done 3 different ways. You could do a blood test at a particular time. If the woman is menstruating, you want to take the blood out at between day 19 and day 21. If you're not, then any day is fine. You can do a blood draw, and then you can also do the same hormones and the metabolites in the urine. So if you do a urine, so the urine is elimination after everything has been processed and metabolized, right? So you're seeing the end result of what has happened in the body. And so that's a very reliable way to check what's happening. So why do that? Sometimes you have to do 24 hours. The technology is improving, so you don't have to collect and carry this big bag with you or the box with you throughout the day. Now we have urine strips. So you can use the urine strips to do the urine testing for hormones. And then we also have saliva. So we can also do the saliva test and check your hormones. I just use blood tests. It's very simple, and people believe the blood test more than they would the urine and the saliva. So I use whatever I can to help people understand what is happening with their biochemistry and the hormones and different things.
And sometimes it is a good idea if you're doing even the urinary testing to follow up, because I know with testosterone, the androgens, sometimes they're not as, I'm not going to say efficient. What is the word I'm looking for?
Yeah, so you've been talking about the ratios between the different hormones.
Right. So there's some discrepancy. So you can correlate with the lab work. Of course, it's totally different ranges, totally different units. But with a licensed practitioner or a clinical practitioner that's used to seeing this, they can make the correlations needed between the two, as well as with symptomology of the patient. So
100%, 100%. But the one major difference between the blood and the urine, I know the technology is advancing quite a bit, but the difference between the blood and the urine would be the urine is more detailed. It's more detailed, and it can test other things that you cannot test in the blood.
Yes. Yep.
So in other words, yeah, the enzymatic activity, various different enzymes that play a big role in the hormone metabolism can be tested much more easily in the urine, sorry. And so that you can see, okay, is that correlating with their clinical symptoms and the presentation? So that way you can make the adjustment in their supplements or the hormones, however you need to do.
Right. And you mentioned earlier about the phase 1 and phase 2 elimination, I believe, and I know that the urinary metabolites can give you some insight into that. Can you tell our audience a little bit about what those 2 elimination pathways are?
Oh, I was talking about the detoxification, the biotransformation pathways in the liver. So there is a phase 1 where the toxin is bound and is converted into a little bit more toxic chemical with the phase 1. And the phase 2 is when that newly formed chemical is now bound to certain things, and that eliminates it through the colon. And that's when you remove the toxin from the body. So that's the biotransformation pathway 1 and pathway 2 in very simple words.
Right. And I bring that up because we excrete some of this through the stool, which is the way it's supposed to be. We're not supposed to circulate all of these old hormones. But I think that the testing that you do really gives us a bigger picture of if that's even the problem. Is that the case? Is it that we're underproducing? Is it that we're overproducing? Or maybe that we're just not eliminating whenever we should be?
Yeah, I mean, there is a hormone, the estrogen can be now reabsorbed. So if it is eliminated in the stool, there could be circumstances in the gut where it enhances the reabsorption of the estrogen that was supposed to be eliminated. So now you have estrogen dominance because now you have too much estrogen in the body. So your body is not able to eliminate fully.
Right. So I guess that ties us into the stool testing or the type of, do you do stool testing for GI health, or what kind of testing would you
For
practically?
sure. We do a full testing called GIFX. I like that test. And it's a 3-day test. So we test for various, your microbiome, your pancreatic output, your enzymes, your pH, your any parasites, anything like that in the body, or bacteria, bad bacteria, inflammation in the gut. You know, there's many different biomarkers to test for all these things.
Mm-hmm. And as you mentioned, you kind of bring it all together to create this protocol so people can be implementing, piece by piece within the 3 or 4 month time period. But is there any circumstance where you would hold off on tackling, for instance, the GI health, um, or allowing the body to kind of build up the energy? Is there anything that would make you reconsider a person's protocol based on the load?
The only thing that I usually don't do in the beginning is a detoxing of heavy metals. I don't like to do that. I know there's many doctors that do that as a first step, but I don't like to do that. Usually what I do is, because people are really suffering for a very long time before they come to my office. They've seen a dozen different doctors. They've done it for years. Most people are suffering for 20 years plus. Most people, I would say 60 to 70% of my patients are suffering for more than 20 years. And this is in spite of seeing alternative physicians and their regular specialists. So my concept is that the person wants to get better fast. And I don't like to see them anyway in pain and suffering. So I like to find out what it is that's going to give me the most gain at the fastest amount of time, because everybody's different. Like, I'll tell you an anecdote. I had a patient whose sister, that I was treating the patient here, her sister was in Colorado. And so she said, I told my sister to see a functional medicine doctor like yourself over there. And I wanted to tell her that. I said, yeah, that's a great idea. She should do what you're doing and doing so well. She said, okay. So she told her sister. And then a month later, or a couple of months later, she told me, my sister is doing very badly. And she's seeing this doctor. I don't know who the doctor was, but she's very upset. And with the hormones, she was doing the hormones. And she was doing very badly. And I said, okay. And then she said, can you please see her? I said, yeah, absolutely. Why don't you bring her here and I can see her? So she flew to California, and I saw her. So I was curious because I wanted to see what this doctor did wrong that the patient was more upset. Because I'm always trying to learn from everyone, right? From the patients, from other physicians, everything. So I noticed, not that the doctor gave her wrong things, he didn't, or she didn't, but the sequence of things was wrong. So, and I said, okay, this is the problem. So I gave her the right thing first, and then gave her the thing that she was given before. So I'm just saying the sequence of how you handle the body is as important as what you're handling.
Absolutely. I'm glad you brought that up. It's very nuanced also, because again, it depends on where the person is at when they come to see you. So I know with people, for instance, in my practice, we see people who have been exposed to numerous, I guess, pharmaceuticals and they've been through surgical trauma. So and there's that neuroplasticity component as well as that toxic burden. And if a person goes straight into the detox, they're going to be hurting and they might feel even worse than they did before. And that kind of dissuades them from going forward. Although in the long run, it might do benefit to get it out of the system, but just at a slower pace, of course. you do want to work with the person and see where their threshold is in terms of any type of load that they can take on in addition to what they've already been living with. So I know you do work with all of these chronic conditions. For our audience, do you see people that have been through numerous surgeries or maybe have had some type of implants and they're considering that that might be one of the potential triggers for their illness?
Oh, yeah. You're talking about the breast implants?
Breast implants and mesh implants, like hernia mesh
Oh,
is a
yes.
really big problem nowadays.
Yes. Yes.
Mhm.
Yes. I've seen several patients with the meshes being put for various different surgeries, whether it's hernia or some vaginal surgeries, or, they are using this. So now you do see illnesses, but literally, if you fix the cell efficiency, then the cell can do its job, whether it is in your brain or heart or your leg or your arm. So what I tried, my focus is to improve the cellular efficiency. So if it is a mash, whatever toxins are coming out of the mash, the cells need to be able to eliminate, be able to perform their jobs. So the whole focus, the way I operate with any patient, is to how do I increase the energy and the cellular efficiency of the person, not only of the person. So the whole person feels better. That means the whole body's cells are efficiently utilizing the fuel to convert it into energy. And again, it ties back straight into the nutrition. So the nutrition has to be proper. And then after that, whatever else is stopping the cell to be not efficient, which is really part of aging. Literally, if you look at it, the aging process itself causes, I think, all degenerative conditions.
Mm-hmm. Yeah.
Mostly, I would think that's the problem. Whatever is stopping it from being efficient is what I'm interested in finding out. Whether it is an infection, a virus, a parasite, a fungus, a mold, or a tick bite, whatever it is, right? Or is a food sensitivity, or is some kind of virus that you've had, Epstein-Barr virus. There is various different reasons why, or you are just simply aging and there is a degenerative condition, your cells are not efficiently dividing.
Mm-hmm.
And so those are the things that we're going to be focused on. And there is a sequence of things that you do correctly. And if you do that, it's not very hard to turn around anybody's condition and get them improving pretty rapidly.
Dr. Mathur, thank you for bringing that up about the cellular function, which you mitochondrial health, even if you want to say it, and that we hear that term in the media a lot. So how does a person go about improving the cellular function alongside with that nutritional piece? Like, what are some of the practical things they can do day to day to improve cell health?
Right. So the cellular health, I mean, there is lots of things you can do, but the sequence, I think, is very important. So you do the nutrition part, and you can do, if you want, depending on the situation, sometimes I do the liver detox earlier on, depending on what it is. Liver detox is not that hard. It's actually very easy, and it's not terrible, and you can get over it like within 24 to 48 hours. You're like really doing fantastic. So it's not that difficult to do and get through. But then there is heavy metals. The heavy metals is the one that I think are the most difficult to eliminate right in the beginning. When the person is feeling terrible and they are really run down, health is not so good, the cellular efficiency is not good, they don't have the energy. I don't want them to even exercise. Some people think, oh, exercise is going to jumpstart something. And I was like, no, exercise is going to increase the inflammation. If you already have very high inflammation, you exercise, you're going to increase that more. So I don't want you to exercise until you have the energy. And mostly, I don't even have to tell the person to exercise, because once they have the energy, they literally want to get off the couch and start doing something. And so it becomes automatic. So it's organically, I just move the person through the whole healing process. There's no, the hammer doesn't come down. Oh, you have to eat this way, or you have to do this way. It's mostly, it organically leads to the next stage and the next stage and the next stage. For example, I'll give you the example of thyroid hormone. Okay. So thyroid hormone, it's a very controversial subject. because many physicians and many practitioners have their own idea about when to treat thyroid. In my experience of treating thousands of patients, what I have realized is thyroid is such a key to good health, such a key to good health. You cannot have good health if you don't have your thyroid optimized. It needs to be optimized, not that you don't have a disease. We're not looking for a disease. I mean, you could have a disease. You could have Hashimoto's, which is very common. It's very common to find an autoimmune disease called Hashimoto's, where the immune system is attacking your own thyroid gland. And it's making it either the hormone go up too high or go too low. Once depends on how long you've had that autoimmune condition. So, but I'm not talking about that. I'm talking about optimizing the thyroid function at the cellular level. And the reason for that is the thyroid receptors are present in every cell of the body, including from top to the bottom, like from head to toe. Every single cell in the body requires a hormone called T3. The leothyronine is T3, which is the active form of the thyroid hormone called thyroxine. So if you don't have the active version of thyroid hormone, you're not going to make the energy no matter what you eat. So this is why I say it's a combination of various different factors that are off, that we want to bring them into balance quickly. And once they bring into balance, the body has an innate ability to heal itself. We are not going to reinvent the wheel. The wheel was invented over billions of years. So we are just mimicking nature, like Dr. Jonathan Wright says. And he's been my mentor. And he talks about mimicking nature. I like that because we are not artificially or synthetically doing something to the body. The body already knows how to heal. We just have to give it the raw materials and the environment for it to do its job. Literally, that's all I'm doing. Yeah. There's nothing magic happening.
And it absolutely goes back to the nutrition piece, because in absence of an autoimmune disease that's been diagnosed and long-term, what you mentioned, like replenishing the nutrients that the thyroid needs to signal to the rest of the body. So I know that many conventional practices, they usually run a TSH, maybe a T4, but really there's a lot more that needs to be looked at. So what is it that you're looking for when you see someone to evaluate thyroid?
Right. So we are not only, so TSH, thyroid stimulating hormone, is not a thyroid hormone, first of all. It's a pituitary hormone. It's like the boss of thyroid gland, right? So that is the boss that gives a signal to the thyroid gland to say, okay, time to make your thyroxine. So great, thyroxine has been made. Now what? The thyroxine itself is a prohormone. That means it's not the active version of the hormone. It looks like, okay, the hormone is sitting there, but it's not doing anything. Make sense? Yeah. So what we do is we are looking at the active version of thyroid hormone called T3, which I mentioned earlier, is the leothyronine. That is the hormone that is active version of the T4, which is thyroxine. So in every cell, T3 is what is used in the Krebs cycle. So in that energy production cycle in every cell, we use T3. So you can have a ton of T4, but if you don't have T3, you are exhibiting the symptoms of hypothyroidism, which is underactive thyroid gland. So now, like you said, absolutely, you can give the minerals that are required for the conversion of the T4 into T3, right? In fact, I'll give you the story of my own son. And when he was 10 years old, I think he was very young. And I just don't know why I did the test, but I did the test on him. I'm very particular about thyroid because I know it's the biggest problem people have. And so I tested his hormones He was very young. I think maybe 11 or 12, can't remember exactly. But I found out he had Hashimoto's. And I said, whoa, he's got Hashimoto's, even though he didn't have any other problems, but he had Hashimoto's. I'm like, okay, we got to fix your diet. So we obviously did his diet, but I just told him, I said, just take selenium. That's just offhand. I said, just take selenium because I don't want to do anything else. He's very young. So he religiously took selenium. He loved the selenium. And the good thing about body is that when you give it the right item, it loves it. The body usually likes what it needs to repair and heal it.
Mm-hmm.
So I never had to tell him second time, take selenium. He just took selenium. And years later now, he's got no Hashimoto's. I've not done anything else with him.
Okay. You tackled it with the selenium. I know some people do the 2 Brazil nuts, but it's not measurable. I think like taking the succinct amount every single day. So that's an option.
Some people, I mean, I absolutely give the option to people. You can take the 2 or 3 Brazil nuts a day, or you can take some. I mean, he just decided to. He doesn't like Brazil nuts. So I said, okay,
Oh.
no problem.
Yeah, whatever works and it gets the nutrition and has the body producing what it needs to, synthesizing and pushing through the body to all of the organ systems. So I want to be respectful of your time, Dr. Mathur. I appreciate you taking us through a journey of what a patient would go through, how a patient would be approached in terms of evaluating the system as a whole. So how can people learn more about you and your methods, or how could they come to see you if you have that availability?
Yeah, I mean, we have a website that's very informative. It's called angellongevity.com. And there is all sorts of information there. There is a contact form that you can fill out. And we have a new patient coordinator that will return your phone call and screen and see if we can help you. And the one thing is that I don't like to take patients on that we can't honestly help. So this is we want to do the screening to make sure that we are able to help you. And if we are, then we will absolutely help you and take you on. But the way to contact is through the website. There is a contact form and there is an email there too. So you can send us an email or call us.
And people can see you from outside of any state or even internationally?
Oh, yes. I have patients from all over the world, from South America, from Europe, Australia, Africa. I have patients from various different places and even United States. We treated a patient that came from Louisiana. She came from Louisiana and she was suffering for almost 20 years. And the whole family came with her because she was beautiful family. So we treated her for a couple of months and she's fine. She went back. She's enjoying her life again.
Very good. So we'll make sure to include that as always in our show notes. And again, Dr. Mathur, we appreciate you sharing your wisdom with us today.
Thank you so much, Sharon, for inviting me.
No problem. Thank you to our audience. We'll see you on the next one. Take care.